Step 1. Place the implant needle in the Lallogun applicator. Make sure that the implant needle is fully seated in the implant device. Tighten the nut, holding the needle so that the point of the implant needle is on the outer edge of the implant applicator. Failure to seat the needle could cause the last pellet to be left in the applicator needle and not implanted. Always use a sharp needle. Step 2. Insert the 랄그로 cartridge in the magazine of the Lallogun applicator with the hole in the axle of the implant cartridge pointed toward the handle of the Lallogun. After snapping the wheel into place, rotate the cartridge clockwise to ensure that the cartridge is properly seated. Then check the window at the top of the Lallogun applicator to ensure that the pellet chamber is aligned with the plunger. Step 3. After appropriately restraining the animal to allow access to the ear, cleanse the skin at the implant needle puncture site with alcohol, chlorhexidine, or other suitable disinfectant. Step 4. The implant site is subcutaneous between the skin and cartilage on the back side of the ear and below the midline of the ear. The implant must not be deposited closer to the head than the outer edge of the auricular cartilage ring. The location for the insertion of the needle should be at a point toward the tip of the ear, at least a needle length away from the intended deposition location. Take care to avoid injuring the major blood vessels or cartilage of the ear. Once the needle is fully inserted, squeeze the trigger of the Lallogun to deliver a full dose of 랄그로. Keep the trigger fully depressed until the implant needle has been removed from the ear to ensure that the implant remains properly deposited.